Welcome, this is To The Root podcast, brought to you by Transitions of Indiana and We Grow Hair Indy, where we get to the root of hair restoration solutions, navigating hair loss, embracing life's journey, and everything in between. Welcome back. Last time we covered some frequently asked questions about hair loss. Today we're going to talk about the global approach with We Grow Hair Indy hair transplant physician and surgeon, Dr. Farhan Contractor. Dr. Contractor, great to have you here. Welcome to the podcast.
Thank you for having me. I'm excited to be here.
Yeah, I'm excited to talk about some topics today, but a little bit of background. Tell us about how you came to be sitting here chatting to me today.
Sure. So I've been a hair transplant surgeon for over 10 years now. I completed my residency in New York. I was very fortunate. I got to do my training out in the Hamptons, and I was introduced to a number of wonderful physicians. Once I was board certified, I went on to do my hair restoration training in Manhattan. And again, Manhattan is definitely one of the centers in which there are plenty of great surgeons out there. I got to learn from some of the best. I had the opportunity to perform lots of strip procedures as well as to do lots of FUEs, and I think that positions me very uniquely to be one of the few surgeons who can really unbiasedly speak about all the various modalities and options that patients have.
Yeah, and that perspective is very important in training. I think that's a very unique thing for physicians coming to the industry today, because some new physicians coming in might just have one perspective, not just both. So I think that's really important, and I guess at the end of the day, making the right decision for the patients that you're working with.
I couldn't agree more. I meet physicians that are just so entrenched in the FUE is the only option now. And then I meet doctors who are like, oh, strip is the gold standard. It's very difficult, in my opinion, to comment on another procedure, another modality, if you haven't either been trained or ever done the procedure. So I genuinely think that it's important for you to have experience with everything. And oftentimes patients will come to me and say, hey, what's the best procedure to do? There is no one best procedure. There is a best procedure for the right patient.
And they use the word practice with medicine for a reason, because it's evolving and changing, right?
Absolutely.
It's going to be different in a year's time than it is today. We're going to talk a little bit about the global approach to hair loss. As you know, when someone comes to the clinic, we talk to them about that. In your mind, what does the global approach mean?
One of the things that I really like to instill in my patients is the sense of understanding that hair loss is dynamic. It's constantly changing. And you're going to come to me at one point in your life where your hair is at a particular phase, okay? And if somebody has been fortunate enough that their hair loss is stabilized and they've had enough hair loss to justify a procedure, we can consider going ahead and performing either a strip procedure or an FUE procedure, depending on their candidacy. Now, the global approach to me is to think about what their hair loss is going to be like in the future. You want to take into consideration what has the hair loss been like in their family members, okay? And I also want to think about, what therapies has this patient already tried? One of the things that always makes me a bit hesitant when working with patients is when they say, Doc, I only want to do a procedure. I never want to take a pill. They're not natural. And I'm just a little bit stunned when they say that sort of stuff, because I know that I'm going to get this patient a great outcome, and then in a decade the patient is going to come back and complain that, oh, now I have loss here, or there's a disconnect between the lateral humps and the hair that we transplanted. Mm-hmm. So for me, I really want to give people the best possible outcome for surgery and optimize their hair, their scalp, for the longevity of their life.
Yeah, and I think that's a really good point. I mean, I've been doing this for 19 years, and we talk about it being a marathon, not a sprint. You and I have both dealt with hair restoration, right? Yeah. And so we've done preventative things. We continue to do them. I think education is a huge part of that. My experience is when you actually sit down with someone and educate them, I think their mindset changes.
100%.
Their mindset changes. And before people walk in, that's where things get very confusing online, where people are very confused around, okay, I just need to do this type of transplant, I'm good, or I just need to do this type of treatment, I'm good.
The internet warriors, the guys who've done their research by going on forums, come to you with their plan. And don't get me wrong, there are patients who've done considerable amount of research, and they are right. But there are also many people who've perhaps been misled by very fancy marketing, and that is a bit of a concern, because there are patients that are being told, oh, you're going to do one procedure and never going to have to worry about hair loss for the rest of your life. And that may be the case in many instances, but in some instances, that's not going to be the case. Right. And especially when patients come to me and they say things like, Doc, I'd really prefer not to have to do this again. Okay, well, let's try to optimize that outcome.
Yeah, and it's always, along those lines, it's always our goal to try to get someone as much hair as you can in a single procedure. And
Absolutely.
If you can get by with not having another procedure, great, but we don't have a crystal ball. And
No.
that's not how hair loss works. It's not how life works. And again, that long-term approach, back to those medical modalities, that long-term approach is going to limit the chances of you needing another procedure sooner.
100%, I agree.
How do you delineate a cosmetic product versus a medical modality that we know works, and what's the marriage between those?
There is confusion around these things, but at the end of the day, we're very fortunate. We live in a country where we do have the FDA. We've had research done, and there's no question that there are medications such as minoxidil, finasteride, ketoconazole that can help prevent further hair loss in patients. Now, unfortunately, sometimes patients will come to me after seeing a very glamorous ad on TV, and they're like, oh, this supplement is so good. They say I don't need to take finasteride anymore. And then I look at the ingredients, and it's just, glorified vitamins. There's a mixture of saw palmetto, curcumin, and biotin, which, again, those things are helpful, but I don't think that any of those supplements can hold a feather to things such as finasteride and minoxidil, which have been proven for decades to generally be safe and extremely effective at preventing further hair loss. In particular, I'm a huge fan of finasteride in the appropriate patient. If a patient's extremely apprehensive about taking the medication, just based on the anxiety alone, I won't push them to take the medication, but I can't tell you the amount of time patients have come to me, I've given them some reassurance, they've taken the medication, and sure enough, they love these medicines, okay? I mean, these guys are just in love with the medication. It happens all the time. It's interesting, when COVID was coming around, people were worried about getting these supplies and toilet paper. I know guys who were calling pharmacies and making sure that they didn't run out of finasteride. So that's the level of love that can be had for these products when they're being used by the right patient.
And is there a atypical right patient for those modalities? And in what circumstance would you say someone is more likely to respond to it than someone that isn't?
It's impossible to tell how people are going to respond to it. I've given thousands of people finasteride and minoxidil. Some folks have come back to me and said, hey doc, I don't think that this is working. We'll look at their before picture and we'll look at their after picture. And yes, there isn't much of a change that's been had, which doesn't mean that it's not working.
Right.
From my perspective, from the perspective of a surgeon, what I really want those medicines to do at the very least is to freeze and halt the shedding process. That's huge.
Mm-hmm.
Because as I mentioned earlier, if you go ahead and do a procedure and there is continued hair loss, either in the region where you transplanted or surrounding it, there's going to be some disconnect, and patients do get understandably concerned about that.
Mm-hmm.
Now, if a patient has miniaturization that's in place, meaning if you look and there's some baby hairs, I do believe that there's going to be a higher chance that the medicines such as minoxidil, finasteride will be more effective in those individuals.
And to be clear, and I know this is confusion with some people, your transplanted hair is genetically permanent. But if you keep losing hair that's not transplanted, then your cumulative gain can drop over the 12 months, right?
All over it.
Right. And I think the advent of different delivery forms of these medications in the last few years has probably opened up the market to certain people. And again, it's not a prerequisite to do these things so that your transplant hair will grow, but if you want the best long-term cosmetic impact, super important.
Look, while the hairs that we transplanted are DHT resistant, they're not 100% impervious to DHT. There are patients who will have the procedure and the caliber of the transplanted hairs will improve as well. And that's something that we talk about amongst hair transplant surgeons. Ultimately, we try our best, especially when we're taking out strip procedures, to take out the hairs that we know are going to stay with you forever. Mm-hmm. But ultimately, if you want to go ahead and maximize the longevity of your native hair, as well as to improve the health of the transplanted hair, minoxidil and finasteride can absolutely work. Minoxidil is a vasodilator. It should theoretically help improve the blood flow to the scalp, as well as to increase the hair's anagen phase, which is the growth phase, and ensure that it stays around as long as possible.
The advent of online ordering with products and different things, and with your experience, you've got some unique experience in this regard. It's I think it's a blessing. In some cases, it's a curse from a education and perhaps marketing point of view.
Sure.
What are your thoughts around that, and how that's changed the perception of someone looking into hair restoration?
So as someone who was a medical director for a telemedicine company that had over 1 million customers, I think my opinion will be a little bit bias in favor of the telemedicine platform. And I'll explain to you why it is, okay? And you were very fair in your assessment. You said that it's a blessing and it could be a curse. The reason that I think that it's a blessing is that there are a lot of patients who are afraid to talk to anybody about their hair loss. It's easy for them to go online and to request something. And a patient who goes online and at the very least gets on something like minoxidil, to me is a huge win.
Mm-hmm.
Now, the downside comes where patients are lured into thinking from fancy marketing that this topical form of so-and-so medication is the best, okay? Or because it costs so much money, it's awesome. I've had people who have stopped taking prescription FDA-approved medications for hair loss in favor of expensive vitamins. And then they call me and start complaining that they're losing their hair. And I don't know how to respond to that. You know, it's very tough when you're trying, like you said, to educate folks, but the marketing is just so glamorous. Mm-hmm. It's tough to convince these people otherwise, especially when they keep using phrases like, oh, all natural. There are a lot of natural things out there. Cyanide's natural. I wouldn't recommend anybody take it, okay? Sure. But ultimately, I think that it is great that patients have the option to be able to access these medications. Now, one of the other downsides of going onto one of these platforms is that folks will sometimes think, oh, okay, well, I have these 3 or 4 options. Let me pick one and only use that. And people are just convinced that they need one. And sometimes they're shocked when I tell them, like, look, if you were to go ahead and combine the finasteride with the minoxidil, use the laser cap, get on PRP, and then also consider taking biotin, that's really going to optimize the chances that you could possibly hold on to your hair, regrow hair, and then the quality and caliber of the hair that you have will continue to improve over your lifetime. Telemedicine is a great platform to some degree, but there are definitely limitations. The downside of ordering online is that oftentimes when you go ahead and request a medication from one of these online companies, the person on the other end is just going to quickly glance over your hair loss and go ahead and just approve whatever it is that you requested. Oh, this guy looks like he has androgenetic alopecia, minoxidil. That's it. Again, there's no consideration of other modalities as we had discussed. Maybe this gentleman could benefit from being on something like finasteride. Maybe if you take a closer look, you might be able to evaluate and see that this is not just androgenetic alopecia, but there might be a component of chronic telogen effluvium. Maybe this person has alopecia areata. Those are things that are going to get missed and not be treated as optimally as they could, because those patients may require other treatment modalities such as intralesional steroids. You know, so these are the sort of things that kind of get overlooked, glossed over.
So, you know, we're both guys, obviously.
I'd like to think I am.
Yeah, it's a good beard. If not, cut that out.
Leave it in there.
Yep. You know, we like to try to keep it simple as a guy, and you can't throw a bunch of products at guys. I hear it all the time. So part of our job in counseling guys is, I think it's real important when we meet with somebody, they understand the type of person they are. And I say to this to guys all the time, like, I have some guys come in, they're type A, they'll do everything. They get me on laser, they're going to do PRP afterwards, they're on finasteride, they're on minoxidil. Then there are other guys who say, look Darren, look doc, what's the simplest yet effective step I can take where I can start out basic and I can add to this? The guy schedules his transplant, often that's something like finasteride. Topical finasteride, which is relatively new to the market, has opened up the space there so far as more people taking that. What's your comment on the different delivery system around that finasteride now?
Well, again, like you said, I think it's incredibly important to keep it simple, okay? There is one medication out there that I think stands head and shoulders above all the others, which is finasteride. That medication will block 5-alpha reductase, which will substantially reduce the dihydrotestosterone levels in your body, and in my experience has shown the most dramatic effects in helping patients to hold on to their hair and regrow hair. Now, there is a very small percentage of patients. In the literature, they say it's less than 2%. In my experience, I imagine that it's even far less than that, who could potentially experience sexual side effects that can range anywhere from decreased libido all the way to erectile dysfunction. You know, I was working for a company that had just recently introduced topical finasteride, and I was very excited about it, okay? Studies have shown that it can be effective in helping to block dihydrotestosterone and has definitely shown some aesthetic improvements in patients who use it over a period of 6 to 9 months. Now, on that note, the efficacy of that medication, I don't believe is going to be as comparable to finasteride. But I still think it's wonderful for the individual who's very hesitant, who's very apprehensive about using finasteride, who may have problems with ED. The last thing you want to do is add another psychological component to it by giving them a pill that may actually induce erectile dysfunction, by offering them a topical version of it. But again, those same guys may come back to us and say, hey, it's kind of messy, it's a pain in the ass to have to go ahead and apply it. So, at the end of the day, if you're having a problem with the standard dose of finasteride 1 milligram tablet each day, consider taking one pill every other day.
Right.
That's worked really well for a lot of my patients. Again, try your best to get on these medicines. And look, you and I are not making any money from selling these pills that cost $9 a month. We're just doing this because I truly want my patients to have the best outcome and for them to, be happy in the long run.
Right. Best.
There are clinics that thrive from not telling you about these medicines. Sure. They want you to lose hair so you can come back.
That'd be the easy thing to do, right?
Absolutely, and that'll be more lucrative. But at the end of the day, that's not how I operate. I really thrive on patients who come back to me and say, hey, doc, you gave me results that I could never have dreamt of.
Right. Yeah, it's a win-win for everybody.
Absolutely.
Right? It's how you build a long-term practice, how you make patients happy.
That's how I sleep better at night, knowing that it's the right thing.
100%.
I'm very fortunate throughout my career. I've worked with pretty notable figures, especially a lot of athletes. And one of the metaphors that always seemed to kind of stick to them was that we need to work on their hair both offensively and defensively. When patients are actively participating in the NFL or the NBA, they're not allowed to use medications like finasteride. It's banned. But I tell them, look, as soon as you're done, once your sports career is over, please go ahead and get on these medications, because by getting on medications like finasteride, I always like to remind patients that the F in finasteride is for freeze. It freezes your hair loss, and then let me go ahead and add grafts into the area that we need it. So this way, you will have the most robust outcome, and the longevity will be there as well.
I had my transplant 19 years ago. I've been doing finasteride, minoxidil daily, and I hear it all the time at consultation. People are like, you've had one procedure. What's your family hair loss pattern? And I tell them it's a Norwood 5. But I'm 51 years old and I've been doing preventative modalities for 20 years.
Yeah.
So, I'm a walking example of it, and I believe in it fully. Works.
I completely agree. I come from a family of men who've almost all lost their hair. And I take some pride in my hair that I have. I still think I have a pretty nice head of hair, and the reason is because I got on finasteride 10 years ago, and I've been able to hold on to what I have. And I imagine had I not, I'd be in a very different position right now.
Yeah, it's great hair, man.
You're very sweet. Thank
love
you.
it.
I grew it myself. What can I say?
I've got you beaten on the grey. Dr. Contractor, thank you for coming on. It's been a pleasure. Of course, this is the first of many, so very excited. It's great to have you on board, and your wisdom is greatly appreciated. So thank you very much.
Thank you for having me.
Thank you. Guys, next time on To The Root podcast, we are going to talk about the differences between FUE and FUT, and how multi-unit hair grafting is a variation on an FUT procedure. Email us at info@wegrowhairindy.com with your questions or topics you want to cover. Head to our website to schedule your free consultation with one of our experts. I'm Darren Andrews. Thank you for listening. Catch you next time.